So student, today we will discuss about the metabolic acidosis and metabolic alkalosis. So first one we will discuss about the metabolic acidosis. Acidosis means production of the acid. So whenever the amount of acid is increases in our body, so this condition cause the metabolic acidosis. Now student, why the acidosis occur in our body? So because whenever acid produced due to the cellular metabolism, so the bicarbonate buffer is utilized, and because of that, after the utilization of the bicarbonate buffer, there will be the formation of acid or accumulation of acid. So this accumulation of acid cause the metabolic acidosis. Yes, student, then we will discuss about the anion gap. So anion gap depend upon the cation and the anion. So the difference between anion and the cation, which is known as anion gap. So how the anion gap is created, so you can understand from here. The sodium and potassium both together make the 95% of the cation in our body fluid, while the bicarbonate and the chloride both together make the 96% of the anion. So the difference between the 95% of cation and 86% of anion, which cause anion gap. But the neutral of the to maintain the neutrality of the biological fluid, so the some of the iron plays an important role, but those iron not contribute in anion gap. So the anion like protein anion, sulfate, phosphate, and the organic acid anion, these contribute in the anion, but these are not measured. Yes, these are not measured, unmeasured anion. So these ions only maintain the charge of the fluid, but do not take part in anion gap. Then student, we will discuss about the normal difference between the anion and cation. So it should be 12 plus minus 5 millimole uh, per liter. It may vary, but not much. What is then we will discuss about the what about the importance of the anion gap. So anion gap playing a very important role to clinical assessment like biochemistry tests in a diagnostic center. So I am giving example here to the understand about the clinical assessment. For example, in a diarrhea, so acidosis occurs. So why the acidosis occur? Because the difference between the anion and the cation increases. So these anion and cation directly related to our metabolic activity and acidosis and alkalosis. Yes, so student, next we will discuss about the metabolic alkalosis. So as we have discussed about the metabolic acidosis, so in metabolic acidosis, the acid increases in our body. Similarly, in the metabolic alkalosis, the base part of the component increases. So bicarbonate increases in our body. Why this metabolic alkalosis occur in our body? It is because of two things. First one, loss of acid. Second one, gain of base. And why the loss of acid does occur in our body? So due to two main reason. These are the severe vomiting and the gastric aspiration. So because of the severe vomiting and the gastric aspiration, loss of the acid takes place. And because of yes student, then because of these two conditions, severe vomiting and the gastric aspiration, the loss of chloride and acid takes place in our body. So this condition, loss of the chloride, is known as hypochloremic alkalosis. So loss of chloride condition is known as hypochloremic alkalosis. Then student, we will discuss about the next condition, that is the hyperaldosteronism. Hyperaldosteronism, why it does takes place? It does takes place because of the extra secretion of the adrenal gland hormone. So because of that, the retention of the sodium will be there. Retention means the sodium ion will not pass through from the cell, and because of that the potassium ions get lost from the cells. So because of this, the loss of potassium cause the hypokalemia. Lack of the potassium is known as hypokalemia, and hypokalemia is directly related to metabolic alkalosis. Yes student, then we will discuss how the metabolic alkalosis takes place inside the kidney. So please wait. So student, in metabolic alkalosis, you can see in the distal convoluted tubules, from the distal convoluted tubules the potassium is getting out from the cells and excreted through the urine, and this case is known as the hypokalemia. So hypokalemia takes place due to the loss of the potassium, and it does takes place by the active transport. Student, here you can see the hydrogen ion is not getting release or exchange, not getting exchange from the urine. So because of that, the pH of urine always be acidic in this condition, and because in the alkalosis condition the pH of urine is not getting alkaline, it is in the acidic condition. So this condition is known as paradoxic acidosis. So paradoxic acidosis means it is the we can say the abnormal acidosis. But in the condition of alkalosis, why? So in the condition of alkalosis, the pH of urine is not getting changed, so because of that it is known as paradoxic acidosis. Yes student, then we will discuss about the metabolic alkalosis. There is a two condition in the metabolic alkalosis due to the chloride. So here number one is chloride responsive, another one chloride resistant. In the condition of the chloride responsive, the amount of the chlorine always be less than 10 millimole per liter, and this is occurred due to the two things, because of the prolonged vomiting, means if the vomiting is taking place longer for longer times, so it causes the chloride responsive metabolic alkalosis. And apart from that, it occurred due to the nasogastric aspiration, when the gastric juice is releasing from the stomach to the intestine. In this condition also chloride responsive metabolic alkalosis occur. Apart from that, the second one, this is the chloride resistant. This is takes place due to urinary chloride is more than 10 millimole per liter, and in this condition we can see during the hypertension and hyperaldosteronism. And apart from that, you can see this one in the severe loss of the potassium and Cushing syndrome. This is the part of the metabolic alkalosis and metabolic acidosis. Then student, we will discuss about the last two things of the acid base balance, and these are two, the respiratory acidosis and respiratory alkalosis. So in the respiratory acidosis, you can see the amount of acid increases, and in the respiratory alkalosis the acid amount is decreases. This is the main difference between these two. And then we are going to discuss about the respiratory acidosis. There are the two types of the condition. Number one, acute condition of respiratory acidosis, then second one, chronic condition. So in the acute condition, we can say the pH of acid minimum fall, and this is takes place due to bronchopneumonia as well as the overdose of narcotic and sedative drugs. And the second one is the chronic. So chronic respiratory acidosis occur due to the obstructive lung disease, like we can say mycobacterium tuberculosis. And in this condition also pH fall is minimum. So this is the these two are the part of the respiratory acidosis. Then last and the final one, this is the respiratory alkalosis. So in the respiratory alkalosis, you can see here the amount of acid is uh, very less in the body, and the CO. Why so why this carbonic acid is decreasing into the body fluid? This is because of releasing of CO2, and when the CO2 get released from the lungs, so the partial pressure of CO2 decreases, and because of that the pH get increases. As you know, the pH get increases, so the bicarbonate level also increases. So these are the four situations by which respiratory alkalosis occur. Now what are the condition by which respiratory alkalosis occurs? So this is because of the hysteria and anxiety, you can say. And apart from that, this is the raised intra cranial pressure and the brain injury. So student, these are the last two topic of the acid and base balance, and respiratory acidosis and the respiratory alkalosis. Student, hopefully you have understand whatever I have taught in this topic. Thank you.